Have you ever wondered why some people develop a particular disease and others don't? Or why a particular drug or medication works for one person but it might not work as well and sometimes at all for another person? Or why a particular diet is good for one person and not for another person? Well, the reason for that is that we're all genetically different. But it's more than just our genetic makeup. We all actually have different environments that we live in, different lifestyle exposures and habits, and different challenges in our lives. And that affects the way our genetic risk or susceptibility to a particular condition, or maybe the way that our body responds to a particular diet, actually happens. So risk assessment is something that is becoming very, very important as a part of what we call personalised medicine. And personalised medicine is about an individual and why they're different to somebody else and what the best form of treatment may be for that individual. Some people talk about precision medicine, what particular drug is going to work in a particular individual. And all of this is really about understanding the individual person, the individual patient in our case themselves. So here at the University of Birmingham, we've had a strong interest in risk prediction and risk assessment. And I'm going to tell you a little bit about that and why we think it's important. So my name is Prof Iain Chapple. I'm head of the School of Dentistry and I'm a professor of periodontology, which is basically the study of gum diseases in their broadest sense. So risk assessment is something we regard as the foundation stone of prevention, and in particular preventive dentistry. And we've developed over a number of years now a number of what we call algorithms or predictive algorithms. These are digital technologies and digital platforms that allow us to convey to a patient what their risk score is for a particular oral disease, and in fact what their overall oral health is. And we convey that information through these algorithms in a very, very simple colour visual that may be numerical, 1 to 5, or maybe RAG rated, red, amber, green rated. Green being good, low risk, good health, amber being in the middle somewhere, and red being at the poorer end or the more worrying end. And the purpose of this risk assessment is twofold really. It's firstly to tell the oral health physician or clinician or surgeon exactly what that individual patient is likely to develop. And so the dental surgeon or the oral health team can focus on trying to put a prevention program in place for that particular condition. But the other thing it does is it allows us to convey to each individual patient why they're different from other patients and what particular aspects of their lifestyle they could change in order to reduce their genetic influence coming through for a particular disease, to try and prevent that disease developing or to delay it from developing. And what these systems have been shown to do is to predict tooth loss, for example. So we've developed a spin-out company called Oral Health Innovations, and that company produces these risk-driven digital platforms that are in use in dental surgeries. So each patient will be able to understand why they're at risk of a particular condition and what they can do to reduce their risk. These algorithms, as well as being shown to predict tooth loss, have also been shown to correlate very, very strongly with a patient's overall health, general health and well-being. And they also appear to correlate very strongly with how a patient feels, whether they have any discomfort, whether they can eat and function normally in the mouth, that is, and also about how they feel about their appearance. I think, however, the most important aspect of these technologies is the education of the patient and helping the patient start to take responsibility for their own health. And we can only really do that if we understand our health and what our risks are. And so we now use these scores, if you like, in what we call personalised biofeedback. And personalised biofeedback is telling an individual patient why they appear to be at risk of a particular condition and what they can do about it. So it empowers the patient to make some lifestyle choices and to change their behaviour to reduce that risk. And independent studies recently have demonstrated two particular things. Firstly, one randomised controlled trial demonstrated that using the feedback, the biofeedback from our technologies, not only improves a patient's positive thinking about the particular condition they're suffering from, but it also enables them to start thinking very positively about changes they'll make and to commit to making those changes. So they understand their condition better, they think more positively about the outcomes, and they genuinely believe they can do something about it. So psychological impact. The other thing that has been shown in a separate randomised trial, done again independently, is that people do appear to change their behaviour when they're shown the scores and the scores are explained to them. And one particular study, published just this month, in fact, in the month of May, in an American journal, has shown that actually people will reduce the infectious burden in their mouths, they'll reduce the levels of bacteria in their mouths by cleaning their teeth better, and they will also reduce the amount of inflammation in their mouths, again by cleaning their teeth better. So without the dentist doing anything in terms of an intervention, patients can actually improve their own oral health by changing their behaviour, changing their lifestyle, and taking control of their own health and well-being. So take control of your own health and well-being. Get a risk assessment done. It's very easy. And in fact, most of the big dental software providers, certainly in the UK, have now integrated our system into their dental software systems. So perhaps if you ask your oral healthcare professional what your risk scores are, it'll challenge them to share that information with you.